Hello and welcome to the Nourished podcast. We've got another fantastic guest joining us this week, and we're going to be talking about HRT. Well, not just HRT, but HRT, bioidentical hormones and body identical hormones. So we're just going to be talking about the difference between the two, what they do for the body, and how we can use them. So my guest this week is Dr. Hannah Watson. Now, Dr. Watson is an NHS GP, but she also runs a clinic called Hormone Balance Clinic, which specialise in the production, or not the production, but the diagnosis and prescription of bioidentical hormones. So it is my absolute pleasure to introduce to you this week, Dr. Hannah Watson. Okay, so welcome to the podcast, and thank you for joining us. Thank you for joining me. I'm really honoured to have you here today as someone with the head of a hormone specialist, shall we say.
Thank you for inviting.
No, you're more than welcome. So I think probably the best place to start is if you just kind of tell us who you are and what you do and introduce yourself.
Okay, so I'm Hannah Watson. I'm an NHS GP part-time, and I also run a private bioidentical hormone clinic called Hormone Balance Clinic that used to be based in a clinic, but given the state of the world and this awful pandemic that we've gone through, has become purely remote and doing lots of consultations like we're having this conversation now, which is seemingly working okay. I guess we'll talk about what that clinic might involve once we get on to talking about bioidentical hormones. Yeah.
Cool. Excellent. Fantastic. So, I mean, one of the biggest questions I get asked from some of my clients who are going through that whole should I go on HRT, should I not kind of conversation is can you explain the difference between the kind of like the synthetic what you'd be prescribed from your NHS GP to the bioidentical hormones? What's the difference between those two types of hormones?
Yeah, so in essence there's three different options. Okay, there is the purely bioidentical hormone replacement that is a bespoke treatment, which I'll explain in a moment. There's two options on the NHS. On the NHS, we've got very synthetic HRT, which is a drug-based HRT that I would probably say is more of a hormone mimicker, which is predominantly looking at estrogen replacement. And within that, you've got an estrogen replacement molecule. And in the ones that are around now, because there were a lot of controversial HRTs, but if we're honest, a number of those have actually been withdrawn from the market because of risks that were associated with them.
Yeah.
There is a synthetic version, a drug version that is estrogen replacement, and within that there is a substance called progestin. And what progestin is a drug, and its role is to keep the lining of the womb thin, because if you gave estrogen on its own, you would thicken the lining of the womb, and that could potentially cause bleeding and even actually changes within the womb that would be stuff that we wouldn't want.
Yeah.
So that is one option. The other option on the NHS is there is actually a body identical HRT available on the NHS. And this is why I'm able to practice as an NHS GP and still manage women in the menopause, because my belief is about true hormone replacement, and therefore I like to give women hormone replacement. And in this body identical HRT that's available on the NHS, that's where I sit when I'm in my NHS office, and I will prescribe body identical HRT where you're getting estrogen plus progesterone. Okay. When it comes to managing the menopause on the NHS, the emphasis is on estrogen replacement, because the belief is that menopause is due to the loss of estrogen. And that is very true. You do lose your estrogen when you become menopausal, and estrogen has all sorts of effects when you become deficient in it. Obviously, a plethora of symptoms that you would develop, your hot flushes, your brain fog, all of these emotional symptoms. And estrogen replacement is really important for that, but also just your general well-being, so cardiovascular protection, bone protection. When it comes to my clinic, when I do my bioidentical stuff, I believe that throughout our lives we have had estrogen and progesterone producing a cycle and working in harmony with each other. And we often talk about a synergy that estrogen and progesterone have with each other. And they can have sometimes opposing effects, but but it's normally a synergy, as in estrogen can work optimally when progesterone is around and vice versa. Therefore, I believe, and those of us who practice bioidentical hormone replacement, we look at the woman, we look at the hormone profile, and we see that you have a decline in both estrogen and progesterone, and we will focus on replacing both of them. So we would use a bespoke, customized way of prescribing something that is much more natural, and we would tailor that according to the lady's needs, but also what her levels are showing. The body identical HRT that is available is a good start on the NHS, but it is dosed. So for anything to be available on the NHS, it has to be licensed, and for something to be licensed, A, it has to be a drug, and B, it has to be dosed. It has to have a standardized dose. So that's where this term of this one size fits all comes into play. That's where there are some flaws with that body identical HRT on the NHS. It's that one size fits all.
Yeah, because I've heard a lot of people kind of say that the NHS, obviously when you do the hormone testing with the NHS, it's quite a narrow sort of field of hormones that are tested in a lot of ways in comparison to what would be looked at from someone who's doing the clinic with the bioidentical hormones. So you're looking at just a few rather than the whole picture.
Yeah, and there's logic there. So like I say, I'm an NHS GP, and the logic when you start as a doctor on the NHS is, how is this test going to change my management plan? And the test that you do, you want it to influence and help aid your either your diagnosis or how you're going to manage that individual in whatever that may be. So when it comes to HRT in a perimenopause or a menopause woman, then the identifying factor in what their presentation is the woman. It is how they are presenting. It's what symptoms do they have? What's changed with regards to their period? When was their last period? If they're around the age of the menopause and they haven't had a period for 12 months, then we have a diagnosis of the menopause. If they're in their 40s and we've got changes in periods and we've got hormonal effects going on and we've got this awful chaotic feeling going on and changes in periods, then they are probably perimenopause. And actually, a diagnostic test in that instance doesn't necessarily change what I'm going to do, because on the NHS, you've got an option there of giving some advice. Obviously, there's lifestyle stuff like what you're doing, there's support that you can give, there are medications that you can give outside of HRT, and then there's the option of HRT. So the hormone testing side of it doesn't actually change what your management is going to be. And like I say, the HRT that is available is this one size fits all dosed effect. So actually knowing what a lady's hormone levels, most women are interested in knowing what their hormone levels are, but will it change how I'm going to manage her on the NHS? No, it's not going to change that. The timing that when you look at kind of nice guidance as to when you might do a hormone test on a woman would be a younger woman. So a lady below the age of 45, then we might look at her periods have changed or have stopped. She's got hormonal symptoms. Is this early menopause? Is this something else? And that would be the time to trigger doing a test.
Yeah, because I suppose a lot of the symptoms that come from the menopause can actually be signals of other things as well. And like I've noticed that working with people's gut health and things like that, there's a lot of symptoms that align with the menopause and that general kind of, imbalance in the body is very, very similar in its presentation to what the menopause or perimenopause would be like. So, you don't want to be put on HRT if that's not what you're requiring at the time.
Yeah, I mean, I'm not being flippant here. You can literally state a symptom and there will be a way of linking it to the menopause or the perimenopause. It's such a wide system approach. Estrogen has over 400 functions in the body. So if you just look at estrogen, once you are having either imbalances or deficiencies with regards to estrogen, it's going to have a huge effect on the body. And it can be all sorts of fairly minor things. You could get skin changes, you get hair changes, you get brain changes, like you say, tummy changes, aches and pains, headaches. The list is almost endless with regards to how how you might present. And there's usually a cluster. There's usually your classics, like I said, the hot sweats, the brain fog. They're usually the classics, but they're not the only symptom. And some of the other things can sometimes be a little bit dismissed if you've not got those classical ones. But that's the doctor's job to dig those out, and to know that there's such a wide range of symptoms that can be presented during the menopause.
Yeah, and it's funny, I was talking to someone this morning and she was saying that I feel like I'm blaming everything on the menopause at the moment, and she was talking about being itchy, and I was like, no, that is a menopause thing. It's just crawling and the collagen and all of that. I said it is a symptom of menopause, so don't feel like you're blaming everything on that, because it probably is related. Yeah. And I was having a conversation, I think it was last week now, about estrogen dominance, and people misunderstand that because it's called estrogen dominance, it means you've got more estrogen, but actually it's just that the progesterone is declining quicker, and there's sort of like a growing gap between the two. So it's not.
And that would be an exact incidence where your standard HRT approach might actually be detrimental, because those ladies who are perimenopause, yes, you're absolutely right. What happens is that usually their hormone levels are declining, but often you find when I do levels in my clinic, you often find that their estrogen often is holding its own. It's often there. Progesterone has fallen off. Because estrogen and progesterone are synergistic, they like having each other around. That does have an impact on how well your estrogen is functioning. But often the estrogen dominance is that this level has come down, but your progesterone has dropped even further. And it's that imbalance that is causing you to have the symptoms. If you then went on an NHS version of HRT, you are getting predominantly estrogen replacement, and therefore you can heighten that imbalance. And that can be where some women say they've tried HRT and it's not for them, it's not worked for them, and that would probably mean that they've been put on one of the estrogens one of the HRTs that has progestin in it, rather than the body identical version of HRT that's available, where you get some you do actually get progesterone in it. But again, that's not for everyone, because that's one size fits all, and some women don't need that much estrogen in the perimenopause phase. And that can be very confusing, because a lot of women think it's all about estrogen. And to be fair, a lot of doctors do as well. I don't mean to be dismissive of my colleagues, but you're right. Progesterone does get ignored really on the NHS.
Because I've actually been prescribed testosterone as well. So, I've got estrogen and testosterone. And I think a lot of people forget that just because we're not men doesn't mean we don't have testosterone in our bodies. And it's just that sort of trying to keep that not balance as such, but just trying to keep them there and keep them doing the best that they can whilst the body's changing. And a lot of the links that come from it are like the impact that stress can have on the hormones and things like that as well. So obviously the stress hormone cortisol has an impact. It kind of steals from progesterone, doesn't it? So it can drive the progesterone down even quicker if you're at a high level of stress and things like that. So like you say, it comes down to the lifestyle that you choose to live, as well as the treatments that you can obtain from people like yourselves, whether it be through NHS or privately. So lifestyle plays, I think, a really big role in the management of your hormones in many ways. So like obviously like you said many times, there's no peri or postmenopausal journey is the same. So the hormone journey that you're going to take is going to be very individual to you, and finding the right ones for you. So is it something where, if you're having issues with certain HRT treatments, whether it's one type or another, if it's not working for you, rather than just stopping and giving up on it, to go and see the doctor and go and speak to your GP and have those conversations?
Well, I think if you are sticking by the NHS, I think my top tip would be to arm yourself with the knowledge of the body identical HRT that is available on the NHS. What I mean, I don't know whether I maybe I've assumed a knowledge here. By what I mean by body identical HRT or bioidentical HRT, what that means is that the molecules in that product are identical in chemical structure to our naturally produced hormones. And that's key in how you will tolerate those. hormones are chemical messengers, and the way that they give their messages by binding to a particular hormone receptor. And if you've got identical molecule, it's going to bind to the receptor in the correct way. It's going to give the body the correct message, and you're going to then process that molecule and that message in the same way you would of your naturally produced hormone. So if you're going to choose an NHS HRT, then I would choose a body identical HRT. What I mean by a body identical is that the molecule in that is the same as your naturally produced hormone. So you are truly getting hormone replacement. The relevance of that is that the way that your hormone gives its message to your body is by binding to a particular receptor site. And if you've got a molecule that's identical to your natural hormones, then it's going to bind to that receptor site in the same way. The body's going to pick up the same message, and you're therefore going to absorb and adapt in the same way that you would have if that was your own hormone. Okay. So on the NHS, there are a couple of body identical estrogens. You can get it in a patch and you can get it in a gel. The progesterone, there is only one. There is only one HRT that has progesterone in it, and that is something called utrogestan, and it's a tablet of utrogestan that you would take. All the other HRTs have an estrogen-like molecule in them, and they have something called progestin. And progestin's only role is to keep the lining of the womb thin. It doesn't have a progesterone effect. And progesterone, like I said earlier, is often not thought about with regards to NHS, but it is our naturally uplifting hormone. It is a real calming hormone, and so it has a real big impact on our well-being and our mood. And often in the perimenopause, particularly in the perimenopause, that's the thing that women really struggle with, is the mood changes and the psychological changes that can come with this hormonal shift. And like you said earlier, it's often the progesterone that has dropped off. Okay? Yeah. So on the NHS, I would always suggest, if you're going to go to your GP armed with something, then it would be saying that you want to try the body identical HRT, and that the one I like is estrogel and utrogestan. So it means two products, estrogen cream and a progesterone tablet. And depending where you are, whether you're perimenopause or postmenopause, will depend on how you take that, because either we have to work with your hormones and therefore give you a cyclical regime, or if you're postmenopausal and the hormones are gone, we're giving replacement, and so therefore it's a continuous regime.
So is there any difference in the way that, like obviously you've got the gels, you've got the patches, you've got the pills. Is there any difference in the way they interact with your body, or is one better than the other? What's the sort of guidelines on the different styles of
well, again, going to the NHS, we should be guided by the woman's choice. So there should be an element of choice in this and what fits with that woman. For me, I would always avoid oral estrogen. The way the body processes oral estrogen, for it to get into your bloodstream, you obviously just to get anything in orally, you swallow it. It has to get digested, and for that to happen, it gets shipped through the liver to get into your bloodstream. And specific to estrogen, that process of it being pulled through the liver can in fact increase clotting, and that's get into the realms of some of the risks associated with HRT that were cited in some of these studies about potential risks with blood clots. Now, if you send estrogen through the skin, which is why there are patches and gels, you send estrogen through the skin, you actually bypass the liver because it gets absorbed through the skin and directly into the bloodstream. So you don't have that increased risk of clotting with a topical estrogen.
Yeah. That's interesting, because my testosterone is topical and my estrogen is oral, and I can tell when I need to have the testosterone, and I can feel it kicking in a lot quicker than I would if I forget to take my pill in the morning for an hour or two. I can tell the difference. So it's quite interesting. Like I said earlier, it's my journey with hormones and HRT and the treatments that I'm having is an ongoing thing. So it is things that I'm kind of talking to my GP about, and one of the things I wanted to ask her when I spoke to her last time was, is there any way of going on to like a topical estrogel or something like that? Because through my own studies, my own sort of scratching away at the surface and looking at things and learning about things, there are certain things about, or certain risks involved with the oral HRT that I was like, I don't want to put that risk on my body on top of other things that are there as well. So I think one of the
I would always prescribe estrogen topically. Yeah.
Good. You're giving me the knowledge now to go and fight for it.
I would encourage you to go back and consider going on estrogen. As much as anything, it is also more of a body identical HRT than the oral estrogen anyway.
Yeah, and isn't there the body identical and the bio identical? They're both absorbed in a much more efficient way through the body, I think. Is that right? In terms of the
well, I guess it's just in that way. I mean, when it comes to the bioidentical bespoke prescribing, then we are creating something that's individualized for you, and therefore it's been created into a cream often that is rapidly absorbed through the skin, and that is probably because of the base cream that is being used. So it doesn't have other artificial stuff in it. It's just there to be rapidly absorbed, pulling the hormone molecules with it to get directly into the skin through the capillaries of your skin. So partly, yes, it's a bit cleaner, but yes, because you're not having to go through the digestive process, you're not losing some of the hormone effect. It's getting straight in there. Now, you can do the same with progesterone. You can send progesterone through the skin, and sometimes I do that in my bioidentical clinic. But again, there's lots of reasons why you may or may not choose to send progesterone through the skin. One of the benefits of sending it orally is that it has more of a calming effect, because kind of the opposite is true of progesterone. As it is digested and passed through the liver, it can have an impact on something called GABA, which is one of our neurotransmitters, and that has a calming effect. So again, one of the issues lots of women have through the perimenopause and menopause is issue with sleep, which is partly disturbed by hot flushes, but can partly be disturbed just by this mind racing and this inability to switch off. And again, if you then take some oral progesterone, your Utrogestan or your bioidentical version, then it will have a calming effect. So it has an effect on helping with sleep or aiding regenerative sleep.
Excellent. So in terms of like with the bioidenticals, because it is something that's so individualized and personalized to each individual patient, is it something that people would need to be, once you've had that initial diagnosis, that initial testing, that initial sort of prescription, is it something that you'd then need to be retested for again at intervals, or is it just, like with the NHS, it's kind of like, this is the pill you're going to take, and we'll only change it if things go a bit funny and don't work for you?
So if I go for my gold standard on the NHS, so I see a lady on the NHS, I'll do her history, I'll try and tailor stuff as best as I can lifestyle wise, but I am, if she is presenting to me with either perimenopause or menopause, and we are having a conversation about HRT, then I will be prescribing her estrogel and Utrogestan, and that is dosed. So that is drug company that's produced that HRT has dosed it, and I will follow the instructions as per that dosing. Okay. As far as monitoring, that's not going to change how I'm going to prescribe it. It's not going to change how that lady has that product. Therefore, there is no testing or monitoring for that.
Yeah.
When it comes to the journey that a lady would have in the bioidentical clinic, then again, we would have the consultation. We talk about all of her symptoms. I often go much more in depth about lifestyle and bring in supplements. But then we will arrange testing, and we will be looking, there's various ways of doing those tests, but we'll be looking at doing some tests and see where her hormone levels are, what the imbalances are, where the deficiencies may be, or just the suboptimal levels. And then we will be creating a prescription that is tailored for her, and that may include estrogen, it may include progesterone, testosterone, DHEA, depending on what the results tell us often you can figure out what the results are going to hint at, but the test will give us a level. We will then use all of that information to create this bespoke prescription, and we will start her off on that. Usually about 6 months down the line, we'll have a review, we'll repeat the tests, see where we've got them to. Hopefully their levels match up with how she's feeling. We'll have another conversation, and if we need to adjust dosing at that point, we can adjust it. So it can be a rolling adjustment. And bearing in mind, a perimenopause woman, she is going through a changes, then those dosing and monitoring times are going to be more frequent than a postmenopausal woman. A postmenopausal woman is essentially, she's low in all of her hormones, and therefore the monitoring isn't going to need to be as much. And once we get her feeling good and looking good on her biochemistry, then we can stretch that intervals for the test requirements.
So when it comes to the testing, what kind of testing from the bioidentical clinic side of things? What kind of testing would it is it blood testing? Is it urine testing, saliva, or is it a mixture of all different types that you would do?
The options again are all of the above, and it's a discussion we would have, and depending on various parts of her story would depend on which test we might think about recommending. Some women will have a personal preference as to what they might want. So obviously when I was seeing my ladies face to face, it was often a venous blood test, so I would take a blood draw when I saw the lady. In this remote setting, we've had to adapt a little bit. There still is the option of getting venous blood tests, and I can just refer to a phlebotomy service, a blood taking service, and get that done. There is the option of doing a finger prick test to assess, which is obviously a home test kit. And then there's the urine test kits as well, which are very extensive because they look at both the hormone level, but also how the body processes the hormone. So it gives a lot more information. Some of it is interesting, but not necessary. But it is very extensive, the urine testing option.
That's an excretionary thing as well, isn't it? So it's kind of like what you're putting out rather as well as what's going on inside. So it's and there is the option of saliva testing as well. I don't do that one very often. That's more if a lady's got a problem with her cycle. So that's usually in younger ladies that I see who've got cycle issues, and I want to do a test throughout a cycle, because that's something easy enough to do on a number of days in a cycle. So it's less common to do that test. Yeah, it's less invasive, isn't it, if you've got to do it regularly to do it.
Yes, exactly.
So what about things like something that, again, I bring it up a lot with my the ladies I work with on a menopausal level, things like environmental toxins. So we've got all things like BPA in our plastics, we've got platelets in our cosmetics and things like that, which are all known sort of estrogen receptor inhibitors or disruptors. So when we're looking at things like your hormone, like the hormone balance, is that something we should, like the xenoestrogens, is that something that we should be considering in terms of what we're using on our skin, what we're using, what we're eating? Pollution, things like that. Because I think that's something that's not thought about in terms of hormones very often. It's something that it's coming up behind everything else, but quietly. So it'd be interesting to hear your take on that.
Yeah, I mean, xenoestrogens do cause quite a significant amount of havoc within our particularly our estrogen balance is recognised, and they're often hidden in, like you say, in products that we put on our skin, pesticides that's in our food chain inadvertently, and you can go down the route of trying to be really healthy with lots of fruit and veg, but if it's laced with a load of pesticides, then that can actually be quite harmful. Your big one you're talking about is your BPA and your plastics, and considering kind of filtering your water. Yes, it has a huge impact. There is a balance to be had there. I'm not a nutritionist. I'm not a functional medic. I try and keep things as simple as possible, try and keep living life as clean as possible, but then again that has to be tailored to the individual, and any changes that you make, they have to be realistic and sustainable to what you're doing. So yes, we need to be good and mindful of these things, but we don't want to be overly restrictive either. So it's again, there's that fine balance of not getting too bogged down with that, but being aware of it so that you can make sensible choices.
Yeah, and this is something I say to my clients, having done like I was a personal trainer for 12 years and a nutrition coach with that, and then sort of moving into this sort of the more women's well-being and menopausal well-being. A message I've always tried to give to my clients is, don't wake up one morning and try and change everything in your life and your lifestyle. Just take it one step at a time, do one thing at a time, find the things that work for you, and then build your lifestyle gradually, rather than trying to overhaul, because it's just too much overload, and your body will just go, no.
Yeah, absolutely. I mean, that comes back a little bit to what you were saying earlier about the cortisol response. Anything like that, too much, it's going to cause a stress response. Inadvertently, you're going to cause a stress response, and you're going to end up with a bit of a cortisol steal, which is going to end up in causing more of a hormone imbalance. You're absolutely right. I entirely agree, and give similar advice myself.
Yeah, okay. One of the big questions, I suppose, with menopause, with hormones, is weight gain. You know, so I've had women say to me they don't want to take hormone replacements or anything like that because it's going to make them gain weight. Mm-hmm. My gynecologist said to me, that's not true. It won't make you gain weight. It's just that women use this time in their life as a reason to not go to the gym. So he was a male gynecologist, I would just say. So I'll put that fact in there before I sort of lynch anyone. But I've been on HRT for, my hysterectomy was a year ago tomorrow. So I've been on hormone therapy for literally 361 days. Yeah. The only reason I have gained weight over the last 6 to 8 months is because I have been sat at this desk and not out actively doing things as I would normally. So is there any truth in hormone replacement therapy making you gain weight, or is it a combination of lifestyle, hormone therapy, age, inactivity? What is the biggest thing that's doing that there?
I'd err on agreeing with you. I think you've got the benefit of being slightly younger. The classical lady that's going through the menopause is a bit older, and as we do get older, then our metabolism does slow down. You've been very proactive in how you've approached this. So again, that's going to have a big positive in how you will deal with that. You're already an active person, and you're taking hormones proactively post-procedure, and so you haven't had that decline. Whereas someone who's gone through a decline, then there are aging things that happen as your hormones decline, as well as a slowing of your metabolism. And once your metabolism starts slowing, it's really difficult to properly kickstart that again. So would I say that HRT causes you to gain weight? Then no. Would I say that the menopause and your loss of metabolism as you age can cause you to gain weight? Then yes, it does. And it's been proactive on that. And I agree with you. Then that's not just about the hormone replacement, that is about lifestyle stuff as well. The chicken and egg there, though, is obviously as your hormones start to decline, sometimes your motivation goes, sometimes your confidence goes, and that can have an impact on how proactive you might be towards your lifestyle.
So it's we're looking at kind of metabolic syndrome in a way, really, aren't we? Because as things slow down, it's obviously going to have an impact on, like you said, like your metabolism, your metabolic rate. Mm-hmm. So it is that lifestyle, trying to keep that metabolism up. So I suppose in a way that's kind of something that you want to try and do as a preventative measure before you get to that level of metabolic decrease, I suppose. So again, that's also then going to impact and improve things like your bone health and things like that, because obviously if you're exercising and you're moving to keep that metabolic rate up, that's going to, obviously depending on the type of exercise and activity you're doing, that's going to help with reducing the risk of osteoporosis and things like that going into the menopause. So I suppose a lot of it, like when hindsight is a wonderful thing. When you look back and go, I wish I had done that a year ago. That's part of my mission, is to try and kind of get that information out to people and say, look, if we do this early enough, that won't be a problem because, or won't be so much of a problem because we'll have done this prior to. And keep the metabolism up and try and keep the body, insulin resistance, blood sugar levels, metabolic rate, all of those things all largely run off of, in a way, hormones and the hormone reactions and things like that. So
I mean, part of what you're trying to do, Leslie, is like you say, empowering women to be mindful of this kind of journey and being proactive in it when they recognize changes. And part of that is getting the message out there that these things happen, and that there is stuff that you can do yourself. It isn't all just about HRT. There are stuff that you can do to try and maintain your hormone levels and your health and your activity level and lifestyle by using lifestyle changes.
Excellent. So from a GP perspective, from a hormone, a bioidentical hormone perspective, how important is movement and relaxation in terms of managing your hormones?
I mean, they're hugely important in dealing with your cortisol level, and the negative effect that excess cortisol would have on your hormone balance. Just from a general well-being standpoint, then obviously there's the benefits of keeping active from a cardiovascular point of view. There's benefits of keeping active from a psychological point of view, and the endorphins that are created by being like that. Truly, hormone balance there's such a big picture to it, and I often say that the HRT or the bioidentical HRT is kind of like the cherry on the top. You've got to build the foundations up. You can't expect that if you've got a really rubbish lifestyle and approach to this, then the hormones aren't going to be the be all and end all. You have to have the foundations built up. And that is both a mindful approach to this and also a healthy lifestyle approach to this.
One of the things I do I run like a 12-week program for menopause. Like, it's called Love Your Menopause. So it's basically trying to kind of put that positive spin on it rather than it always being the doom and gloom. And one of the biggest things we put in there, one of the biggest topics we talk about in there, is stress and trying to reduce the stress and reduce that impact of the cortisol upon the body. As a yoga teacher as well, it's kind of like doing that side of like slow down and maybe doing a bit of restorative yoga and trying to balance the sympathetic and parasympathetic nervous systems and trying to get the body to just calm it down, turning off that stress response and just finding that balance in the nervous system, because it is so many of the people that I've worked with over the years have just been at such a heightened state of stress. That's what's affecting their gut health. That's what's then impacting the way they feel mentally. And once we sort of kind of switch off the nervous system a little bit, switch off the active part and allow the relaxation part to kick in, we've then worked with the gut to try and help clear reinvigorate the gut with healthy bacteria and using things like prebiotics and food that are naturally prebiotic and that. Then all of a sudden they're like, oh, my brain is so much clearer because what's going on? Why I'm not taking my HRT at the moment? So why? Well, it's because you've not got all of this stuff going on underneath it that's then affecting the things that you notice. So obviously we can only see what we feel, which in terms of menopause is often, like we've said, the hot sweats, the night sweats, the brain fog, everything internally is we don't know about it until it's presenting it to itself to. So if someone wanted to come and see you as like a bioidentical, if they wanted to talk to you about the bioidentical side of things, if they weren't happy with, I don't know, whatever they were getting from their GP, or they wanted to just go for that more natural, gentle kind of way, what would be the process of going through that with someone like yourself and sort of approaching you? What would they need to do?
So the journey with me is we'd get you booked in. We've got remote booking now, but or you just reach out via an email, and we would tee up an hour's consultation. That preferably would be in this format, so via a video. Occasionally it could be via telephone. I prefer a face-to-face video. Personal, we get to know each other better. And we will go through symptoms, we'll go through past medical history, we'll go through lifestyle, have a talk about supplements, and then I will expand upon what the hormones are, what I think might be imbalanced, and we'll talk about investigation options, and we'll get those arranged. We'll have another conversation once we've got the test results back. And then we'll talk about how we might optimize both levels and balance between those hormones. Create a bespoke prescription that is sent to a pharmacy called Customized for You, which is a specialist pharmacy that specializes in bespoke prescribing of bioidentical hormones. They work remotely as well, so the prescription is sent electronically and they post the prescription to you at home. And then obviously I'll talk you through how you were going to use your treatment, and we would arrange a follow-up depending on how long it's going to take for this to kick in for you, and what stage of life you're at. But I have an open access email for any queries and comments along the way.
Sure. So every prescription is completely personally made per individual. It's not, like you say, it's not a licensed dosage from like you would get from the NHS, that however many people have.
Yes, when the pharmacy receives the prescription, they are making that product from scratch for you. So there's a little bit of a delay. It can take up to a week for you to get your product, because they're not just a load of bottles on the shelf. They'll take that prescription and then they start making it very much specifically for what we feel your needs are.
So I suppose at the moment, in a way, it's kind of, it doesn't matter where people are either, does it? If it is, like you say, remotely done, they post the bits out to you, and if you can do that consultation via a phone or via a Zoom or a Skype or something like that, then you can literally be anywhere and have that conversation.
Yeah. So, I mean, I've always offered a remote. So ever since I set up, so I've had remote clients even before lockdown happened. So it's not a new thing. It's now the norm. So I've been doing it remotely as long as I've been set up. So I do have clients all over the UK.
Excellent. And I think one thing I was interested in, that with the bioidentical hormones, what are they made from? Is it it's plant-based, isn't it? I think, or natural peri?
It's a plant-based product. So essentially, it's yam. So they extract a molecule from yam, and then they make that molecule into identical structures to the individual hormones. So plant-based product.
Because obviously we take on hormones, don't we, from like the phytoestrogens and things like that from the plants that we eat, but they don't, obviously we're not getting them at such a level that we necessarily utilize them as a hormone. They have some benefits, but they won't fit into the hormone receptor and have the same message as a true hormone molecule would. No. So if people wanted to come and see you, where would they find you for like the bioidentical hormones and things like that?
So my clinic is called Hormone Balance Clinic. So I have a website, www.hormonebalanceclinic.com. Nice. And there's a contact page on there. They could just drop me an email, and we would sort out an appointment.
Excellent. And is there anything else that you think we've not, maybe skipped, or something that I haven't asked, or maybe should have asked about HRT or bioidenticals that we should share with anyone listening?
No, I don't think so, Leslie. I think it's just more of you spreading the word and empowering people to be proactive. I think that's the key, really, is that everyone goes through this at some stage, some earlier than others, some more dramatically than others. Every woman's different in how they go through it. And it's not something you have to suffer through. Few women do manage to sail through it, but most of us have a little bit of a struggle when we're going through it, and there's plenty of information and support out there. You just need to know about it to be able to.
I think one of the things I've heard a lot of women saying to me more recently, especially during the current like restrictions and the way we're living during this sort of like COVID lifestyle that we've got, is the anxiety that's coming with peri and postmenopause is just so extreme at the moment. So many women are really, really suffering with that. So it is, like you say, everyone is different, but there are similarities between obviously the symptoms that we get. I've touched wood, I haven't had any of that, but everyone I speak to, every one of my clients I speak to, everyone that I talk to, whether it's sort of just through work or not, like through personal people, like friends and family, everyone's got a different story when it comes to the menopause, but everyone's got one. So everyone, like you say, everyone goes through it at some point. So yeah, I think it is important to kind of get that information, like you say, that you don't have to suffer through it. That's kind of my message, is it doesn't have to be necessarily a negative time in your life. It doesn't have to be a difficult stage of your life. It's, if you approach it with the right mindset and the right information and the right knowledge and tools, then life doesn't need to necessarily change. It's just a little bit different. So brilliant. Well, thank you so much for joining me today, Hannah. It's been really, really interesting. And obviously, if anyone who's listening to the podcast wants to come and check you out, then I'll put all the links to your website and things in the description, so they can come and find you directly.
Yeah.
Hopefully they'll have learned a little bit more about HRT and the hormone. So thank you ever so much. It's been really, really cool, really interesting, and I hope everyone's enjoyed listening to it. So thank you. Take care.
Bye.